Very good afternoon. Thanks for joining us here on The Big Story. I'm Afrida Rahman Ali. We are going to look at certain very important figures that has come on the mental health disorders and the impact of the pandemic on mental health on Indian citizens. We have the facts and figures out before us now. As per a latest release by National Institute of Mental Health or NIMHANS, there has been a staggering 300% surge in the cases of post-traumatic stress disorder. We will have experts explain to us what this means, what kind of disorder this is, but let's be very clear that this is a data that is drawn out of the distress calls received, which compared to the first wave, which used to be somewhere around 3,500 to 4,000, has now gone up to 14,000. So it's at over 3 times the number of distress calls received. And purely on the basis of that, at the moment, we are looking at a huge jump in the number of people going through mental distress of various kinds and degrees. The helplines are flooded with people trying to cope with loss, as well as calls from COVID warriors who are experiencing burnouts. Now, these are important issues that must be spoken about, and that's precisely what we are going to do, because we'll have experts decode this information for us. But before I go to my guests, another perspective here, which is very critical, viewers, is that we are a country with over 90 lakh people already with mental disorders, 5.7 million with depressive disorders, and 449 million with anxiety disorders. So this is the overall picture. 1 in 7 Indians were affected by mental disorders of varying severity from the year 2017. Now add to this the element of the pandemic-induced anxiety, stress, and of course the confinement, the staying indoors for prolonged period, what it can do to your mental health. Let's understand all of this with our guests this afternoon. Joining me, Dr. Santosh K Chaturvedi, Consultant Psychiatrist, former Dean and retired Senior Professor of Psychiatry from NIMHANS, Bangalore. Welcome, Dr. Chaturvedi. Thanks for joining us. Also, Dr. Nimesh G. Desai, Professor of Psychiatry and Professor of Psychiatry and Director of IHBAS, also joining us. Dr. Desai, thanks and good afternoon. I want to begin with you, in fact, Dr. Desai, because I always believe in getting the jargon out of the way. So when we say post-traumatic stress disorder, for the sake of my viewers, first let's understand this. What does this mean? Because this is the term that is being used by NIMHANS to describe the quantum of the problem now. First wave compared to first wave, the second wave, the number of calls received are much higher, 3 times higher. But decode this term for us, Dr. Desai. What are its symptoms and who is susceptible?
Sure. Post-traumatic stress disorder is a concept that emerged after the Korean and, more importantly, the Vietnam War that the American forces were into. People, after spending a lot of time in heavy stress areas, when they got back to the civil society, they carried a lot of imagery repetitive of that and all the associated symptoms, including nightmares and a whole lot of other symptoms. Any individual or collective trauma can lead to post-traumatic disorder after 6 months or 1 year, over the years where person continues to suffer with those symptoms as I enumerated. But one must clarify that PTSD is a very well-defined category, and with all respect, a lot of us in the media as well as professional and semi-professional circles tend to lump every post-stress problem as post-traumatic stress disorder, which is actually a disservice in every direction. We need to identify those who actually have PTSD and give them appropriate treatment. There'll be a lot of people who have temporary anxiety, distress, who might make those phone calls at the helplines. Not everybody making a distress call is a PTSD case. I'm sure my friend and colleague, Dr. Chaturvedi, will agree with that.
Yeah, I mean, I think...
Right, so those distinctions are important, Dr. Desai. I'm going to... Yes, I will come back to you, Dr. Desai. Dr. Chaturvedi, the figures that we have from NIMHANS is what has provoked a lot of discussion now, which is, of course, healthy because there are very few occasions that we discuss these issues. But if you can give us an understanding of the proportion of the problem, are the psychosocial needs of people being completely ignored? while we talk about the fallout of the pandemic, we talk about treating the physical symptoms, somewhere down the line we have forgotten that there's a huge mental fallout as well that the entire country is faced with.
Well, I agree with you that psychosocial needs are, being sidelined. But I should also mention that when the first wave started and there was a stigma towards COVID-19, the stigma towards mental health came down because suddenly everyone became aware of mental health issues. The government of India, set up a task force. All helplines were started, and a lot of people were taking help from psychologists and social workers and doctors for this. So somehow the mental health awareness became very, very good. So COVID-19 was a blessing in disguise for mental health. And but on the other hand, as you rightly mentioned, the way it had affected hundreds and thousands of people, we don't have the appropriate services for them. Now, coming back to this point about PTSD, I would like to mention there are two things. One is post-traumatic stress disorder, which Dr. Desai very beautifully explained. Then we have post-traumatic stress symptoms. Now, post-traumatic stress symptoms are symptoms which are occurring, which Dr. Desai mentioned. To have a disorder is, requires much more of standard evaluation to be able to say that it is a post-traumatic stress disorder. Also, when I came to know that you are going a feature on this topic, I was just looking at the literature, and it's amazing. China has 20% of people who are COVID survivors have PTSD. I'm not talking about symptoms, PTSD. Italy had almost 30%. UK had a very large proportion. So many countries which have studied PTSD have actually found it to be the commonest mental health psychiatric problem in their populations. And some of these are comparative studies, whereas in people who are living there but have not had COVID-19, it's only about 5%. But in others, it was like 20%, 25%, 30%. So we haven't done a study. What you are reporting is according to the calls made to the helpline. And, so that is, very superficially one asks, so what is the reason for inquiring? One doesn't do a standard evaluation.
No, that is true. I concede that this is only figures that we have from NIMHANS based on the distress calls, sir. It's not based on any larger study. But since you brought up about other countries and their studies, let me refer to one such study, that Ottawa study, which talks about, similar to what you just mentioned, that patients discharged from ICUs have higher risk of suicide and self-harm. This is something that they have found out. And you are also, of course, referring to the fact that patients who are survivors, 1/3 of them in China you were referring to, have PTSD, and the clear distinction that you made between a disorder and symptoms. I want to come back to you, Dr. Desai, to talk about the report that we are using to do this program. Is this report from NIMHANS that has given us two kinds of things. First is that the numbers have increased of distress calls. It also talks about the nature of calls, the nature of support sought in the second wave is very different from the first wave. The first wave, it was more about the stigma. The second wave, things are more about grief and loss and bereavement. Now, in your experience of dealing with patients, do you see that kind of a shift?
Sure. What you're saying is something that actually none of us needs to be told, because all of us in India and across the world, especially in India in the second wave, have lived through. To very briefly state, there has been huge collective and cumulative stress of health infection and fear, of economic issues, of going through ICU experience, of having people in the family and friends die, where you can't even follow all funeral rites or all the socio-cultural mechanisms. And so for absolutely no doubt, there is a lot of cumulative collective stress. But like Dr. Chaturvedi put so well, post-traumatic symptoms or acute stress symptoms not be confused with the PTSD as a syndrome. One, to keep repeating, distress calls not be confused as PTSD. Let me also cite that with ICMR, our own study in Gujarat earthquake, where we got into for the Bhuj area within a month of the earthquake, we had an 8 to 9 year follow-up of 35,000 people, and there was virtually no PTSD. So the major point that I think Dr. Chaturvedi and I would both like to get across to you, which is also a positive message, is that as compared to the Western countries, there is a lot of natural, positive, resilient mechanisms in our culture. Individual resilience, family support, social support. But yes, it must be flagged that we must keep our mind open. Second wave has been unlike anything else, and we must look at how data emerges.
Yes, this is very important, and thanks for that positive note. And that must be underlined that while we talk about the distress calls, the mental health impact, there's a lot of resilience as well. But my worry is, Dr. Desai, when we talk about healthcare professionals, for instance, much of it is underreported as well. And yes, it wouldn't be fair only to bank on the distress calls. But, you know, don't you also think that a lot of the healthcare workers, the frontline workers are expected to, over and above the other protective mask, they put on a mask of resilience, a brave front, even when they are crumbling inside?
That's a very valid point. Frontline workers, especially those who have been working in COVID ICUs, nurses, doctors, other professionals, are very much at higher risk. But it also occurs to me, Afrida, and I'm sure my friend, colleague, Dr. Chaturvedi will agree. I'm sure you will agree.
So I think
Dr.
one is the
Chaturvedi, your
resilience,
response
but
to
one
that.
should
And
also say it is
It's a good indication for us to
No.
see. Sorry, if we can prevent PTSD through good handling of these distress calls, if we can handle the current distress of the society well, we might actually be preventing PTSD or other mental health problems. That's a very positive direction.
Okay. Yes, yes. Okay, so symptoms are the first step, and before it becomes a disorder, it can be treated. Dr. Chaturvedi, your views on that, please.
Yeah, so I would say partly it is resilience and partly it is tolerance, you know, and I don't know whether sometimes you can say it's a pathological tolerance that we have as a country and as a nation, you know, where we see so much more disasters and distress. It's become like a part of life. So we have, you know, underneath there is a veneer of steel in most people, and, you know, we deal with this. So it is to some extent, one should say that we look at things in a very different perspective. But the issue which you mentioned about frontline workers, I would say the PPE for them is psychological protective equipment that they wear. It is not a personal this thing. It's a personal one also and a psychological one also. So they have a very, you know, a unique commitment to society, commitment to people, commitment to saving lives. I have seen many of my friends and my students and doctors, you know, who are ready to take risks for everything, and you know, without caring so much that what would happen to them, despite their families telling them to be much more cautious. So this is a very important point, because as you just alluded to it about burnout amongst them. Imagine if we have already a very short, small force, and if the rate of burnout and stress in them is going to be high, it is going to directly influence the number of people who would be able to provide proper care. So it's very important to address issues of stress and burnout amongst doctors, nurses, ward attendants, you know, everybody in the hospital, and not only them, even other frontline workers like, you know, the police and the media and so many other groups are there who are in the front line. So unless we do that, it is, it's a, what shall I say? It's a Sisyphus phenomenon. Yeah, the more you try to do, the less happens. So it is very important that they should take care of themselves, and we should provide help to them. So otherwise, this burnout is going to have a very, very negative effect.
That's a very critical area. You know, today we are reporting instances of healthcare workers being physically assaulted. I mean, that's how bad it is. And here we are talking about how their mental health issues must be taken care of. We seem to be far off. from that, which is unfortunate. Quick last word to you, Dr. Desai, because there is a huge concern in this country with regards to the treatment gap, and you would be aware about these figures that what we have is 15 lakh Indians have diagnosable mental illness. Only 85% of them, roughly 85% of them would not receive any treatment, which means only the remaining 15% do get treatment. Now, is this because there is a shortage of psychiatrists and professionals like yourself? We have that graphics on our screen, which will show you that per 100,000 population, only 0.3 psychiatrists. Dr. Desai, how do you think that this is a problem, a flaw in our system?
Sure, that's a very important topic, but allow me half a minute of reflection on what Dr. Chaturvedi was saying. It just occurred to me as Dr. Santosh Chaturvedi was saying what he was saying, of the very old English saying, a stitch in time saves 9. So about psychological stress, about distress, about all the traumatic experiences that almost all of us have gone through at different levels, what's required right now is preventive action, and the preventive and mental health promotive actions will be really more by the society and family and friends. Now link that to what you were saying. We have shortage of mental health professionals.
Right.
We do have Government of India's mental health program available on paper, in theory, on all districts, but access and utilization is still low. Like Dr. Chaturvedi had said at the start, we are all finding kind of a painful realization that this epidemic has at least brought the social awareness about mental health higher. We are hoping the long-term effect on stigma will be that people will be stigmatizing mental illness less, and people will come forward for mental health seeking help much more. I'm also with Dr. Chaturvedi and you that when there has been such a gap, let me illustrate this. If the Indian data is very clear. Out of 100 people, the global figure for mental health problem is 25, 1 in 4. In India, it is 1 in 10. Fortunately, we had less of a problem. Of course, we didn't have services. Now, 8 of them were not getting any mental health help. This is the time for us to strengthen professional help, para-professional help, and the family social level help, so that not everybody needs to reach NIMHANS or IBAS or even medical colleges. People should be able to help themselves or each other. I'll keep repeating, as I keep saying on many platforms by now, sharing is caring.
Right.
And caring will prevent serious mental problems.
Right. On that note, I close this conversation. Dr. Nimish Desai and Dr. Santosh Chaturvedi, thank you so much for joining us on The Big Story this afternoon. I think ultimately there is, of course, this larger consensus that what we need is sensitivity, we need empathy. Sharing is caring. Do feel free to share your issues if at all you feel anything. That would be the first step, and that would, of course, reduce the burden on your mental well-being and could prevent further disorders. So taking that first step of sharing is extremely critical. Thank you so much for joining us.